Mental health occupies a unique place in human understanding because it deals with experiences that are deeply personal, often invisible, and difficult to measure. People can see a broken bone or a wound, but thoughts, emotions, fears, and motivations exist inside the mind. Because of this invisibility, mental suffering has historically been misunderstood, minimized, or stigmatized. In modern times, technology has been seen as a way to finally make the invisible visible. Brain scans, in particular, have become symbols of this hope. They appear to offer concrete evidence of what is happening inside the mind, turning subjective experiences into objective data. As brain imaging technology has advanced, its images have become more accessible to the public. What was once limited to research laboratories and hospitals is now shared widely through social media, documentaries, and promotional material. These images are often simplified for public consumption, stripped of technical explanations, and presented with confident interpretations. The result is a powerful impression that mental health problems can be directly observed, categorized, and explained through brain images alone. This impression is appealing because uncertainty is uncomfortable. People naturally seek explanations that feel solid and definitive. When someone is struggling with mood swings, anxiety, lack of focus, or emotional pain, vague answers can feel unsatisfying. A brain scan seems to offer a clear reason the brain looks a certain way, therefore the problem exists. This narrative reduces doubt and provides a sense of closure, even if that closure is premature. However, neuroscience does not work in such a straightforward manner. Brain scans capture patterns of activity or blood flow at a particular moment under specific conditions. These patterns are not fixed signatures of identity or destiny. They are influenced by context, task, emotion, and environment. The brain is constantly responding to internal states and external demands. A scan taken during stress will differ from one taken during rest. A scan taken after poor sleep will differ from one taken after adequate rest. Treating these fluctuating patterns as permanent traits misunderstands the nature of brain function. Another limitation lies in interpretation. Brain imaging data is complex and requires careful statistical analysis. In research settings, conclusions are drawn by comparing large groups of people and identifying trends, not by making definitive judgments about individuals. When images are removed from this context and presented alone, they lose much of their meaning. Colors and shapes may look dramatic, but without proper comparison and controls, they do not provide clear answers. Mental health conditions themselves are not single entities with clear biological boundaries. They are clusters of symptoms that vary widely from person to person. Two individuals with the same diagnosis may have very different experiences, triggers, and responses to treatment. Expecting a single brain image to represent such diversity is unrealistic. It oversimplifies conditions that are already difficult to define. The use of brain scans as explanatory tools also affects how people think about responsibility and change. When difficulties are framed as purely biological, individuals may feel relieved of blame, which can reduce stigma. At the same time, they may feel powerless. If the brain is the problem and the brain is seen as fixed, then personal effort may seem irrelevant. This belief can undermine motivation to engage in therapy, build coping skills, or make lifestyle changes that require time and commitment. Modern neuroscience contradicts the idea of a fixed brain. Research consistently demonstrates that the brain changes in response to experience. Learning new skills, forming relationships, practicing emotional regulation, and undergoing psychotherapy all produce measurable changes in neural activity and connectivity. This capacity for change is central to recovery. Narratives that emphasize static brain defects obscure this hopeful reality. There is also a social dimension to consider. Mental health is shaped by social conditions such as poverty, discrimination, isolation, and trauma. These factors do not reside in the brain alone, yet they have profound effects on psychological well-being. Brain scans cannot capture social stressors, personal meaning, or cultural context. When explanations focus exclusively on the brain, they risk ignoring the broader forces that contribute to suffering. The commercial use of brain scans further complicates the issue. When services are marketed directly to consumers, the line between education and persuasion can blur. Promotional messages often emphasize benefits while downplaying limitations. They may suggest that scans can reveal hidden problems or prevent future illness, even when evidence for such claims is weak. This creates unrealistic expectations and can lead to disappointment or financial strain. Healthcare ethics emphasize informed consent, which requires that individuals understand what a procedure can and cannot do. When brain scans are presented as definitive diagnostic tools without clear discussion of uncertainty, informed consent is compromised. People may agree to procedures based on misunderstandings rather than evidence. The popularity of brain scan narratives also reflects broader cultural trends. There is a growing fascination with optimization and self-improvement driven by data and metrics. People track steps, sleep, productivity, and mood. Brain scans fit neatly into this mindset, promising deeper insight through technology. However, not everything meaningful can be quantified. Emotional growth, resilience, and understanding often emerge from reflection and relationship rather than measurement. Another concern is how brain scan interpretations can influence treatment choices. When a scan is presented as identifying a specific problem area, treatment may be narrowly focused on correcting that perceived defect. This can lead to one-size-fits-all approaches that ignore individual differences. Effective mental health care is personalized, flexible, and responsive to feedback over time. The role of uncertainty in science deserves emphasis. Scientific knowledge advances by questioning assumptions, testing hypotheses, and revising conclusions. Uncertainty is not a failure. It is an inherent part of discovery. Viral presentations often portray uncertainty as weakness, favoring confident statements that attract attention. This distorts public understanding of how science works. Education and critical thinking are essential tools for navigating these issues. When people understand that images can be persuasive without being definitive, they are better equipped to evaluate claims. Learning to ask questions about evidence, methodology, and limitations empowers individuals to make informed decisions about their health. The future of neuroscience holds promise. Researchers continue to explore brain networks, genetics, and biomarkers that may one day enhance diagnosis and treatment. These advances should be welcomed with cautious optimism rather than premature certainty. History shows that many early claims in medicine require revision as evidence accumulates. Mental health care benefits most from an integrative approach. Biological, psychological, and social factors all contribute to well-being. Brain scans can contribute to research and understanding, but they should not overshadow the human elements of care. Listening, empathy, and collaboration remain central to healing. Ultimately, the fascination with brain scans reflects a desire to understand ourselves. This desire is natural and valuable. However, understanding the mind requires more than images. It requires attention to experience, context, and meaning. Technology should support this understanding, not replace it. By recognizing the limits of brain imaging and resisting oversimplified narratives, society can move toward a more balanced view of mental health. One that values science without exaggeration, technology without dependency, and clarity without false certainty. Genuine progress in mental health will come not from viral images alone, but from sustained investment in research, education, ethical practice, and compassionate care. When these elements work together, individuals are more likely to find understanding, support, and hope. This approach honors both the complexity of the brain and the depth of human experience. Health has always been an area filled with uncertainty, debate, and evolving understanding. Unlike many physical illnesses that can be confirmed through blood tests, imaging, or clear biological markers, mental health conditions are defined by patterns of thoughts, emotions, behaviors, and lived experiences. In recent years, however, brain scans presented in viral online content have been promoted as if they can finally remove this uncertainty. These images are often shown as definitive proof of mental disorders, personality traits, or cognitive limitations, giving the impression that complex human experiences can be reduced to colored patterns on a screen. The growing popularity of these scans reflects a deep human desire for certainty. People want clear answers, especially when they are struggling emotionally or psychologically. When suffering is invisible, it can feel invalidated or misunderstood. A brain image appears to offer validation by making distress visible and measurable. It suggests that emotional pain has a concrete biological explanation that can be seen, labeled, and potentially fixed. While this idea is emotionally powerful, it does not align with how mental health science actually works. Brain scans commonly used in viral discussions measure indirect indicators of brain activity, such as blood flow or energy use. These indicators are not stable traits. They fluctuate constantly based on internal and external factors. Stress, fatigue, excitement, fear, focus, and even expectation can alter brain activity. This means that what a scan shows is a snapshot of a moment, not a permanent map of a person's mental health. Treating such snapshots as diagnostic truth ignores the dynamic nature of the brain. Another critical issue is that similar brain activity patterns can appear in very different people. A person experiencing temporary stress may show patterns similar to someone with a diagnosed anxiety disorder. A highly focused individual may show patterns that resemble those associated with attention problems. Without context, these images are ambiguous. Interpretation depends heavily on assumptions, expectations, and narrative framing. When viral content presents interpretations as facts, it hides this ambiguity from viewers. Mental health diagnoses are not based on isolated biological signals. They are constructed through careful clinical evaluation over time. Professionals assess how long symptoms have been present, how severe they are, how they affect daily functioning, and how they interact with personal history. They also consider cultural norms and situational factors. Brain scans, when used responsibly, contribute to research at the group level, not to definitive conclusions about individuals. A significant risk of viral brain scan content is the way it shapes self-perception. When people are told that their brain shows damage or abnormality and they begin to see themselves as broken, this identity can become deeply internalized. Instead of viewing challenges as responses to life circumstances, individuals may believe their struggles are inevitable consequences of brain defects. This belief can reduce motivation to seek therapy, build coping skills, or make lifestyle changes. This effect is intensified by the authority associated with medical imagery. Brain scans look objective and final. They do not appear to leave room for interpretation or change. Yet modern neuroscience consistently shows that the brain is highly plastic. Neural connections change with learning experience and recovery. Psychological interventions, education, social support, and habit changes can all lead to measurable changes in brain function. Presenting the brain as fixed undermines this scientific reality. The marketing of brain scans often emphasizes early detection and prevention. Viewers are encouraged to believe that unseen brain problems may exist even without symptoms. This messaging can increase anxiety and hypervigilance. People may start monitoring normal emotional fluctuations as signs of serious disorders. Instead of promoting mental well-being, such narratives can increase fear and self-doubt. Ethical concerns also arise when expensive medical services are marketed directly to the public without strong evidence of benefit. Vulnerable individuals may spend large amounts of money seeking certainty or reassurance. When promised outcomes do not materialize, disappointment and mistrust can follow. In healthcare, trust is essential. Overpromising and under-delivering damages that trust. The persistence of viral brain scan narratives highlights broader issues in science communication. Scientific research operates through gradual accumulation of evidence, replication, and peer review. Conclusions are tentative and subject to revision. Viral media operates differently. It rewards clarity, confidence, and emotional impact. Uncertainty is often perceived as weakness rather than honesty. This mismatch creates fertile ground for oversimplified claims to flourish. There is also a cultural tendency to prioritize biological explanations over psychological or social ones. Biological explanations feel more legitimate and less blame-oriented. While reducing stigma is important, it should not come at the cost of accuracy. Mental health involves both biology and meaning. Thoughts, beliefs, relationships, and values matter. Ignoring these dimensions reduces people to machines rather than complex human beings. Another overlooked consequence of oversimplified brain scan narratives is the impact on treatment expectations. When problems are framed as purely biological, people may expect biological solutions alone. They may believe that medication or technological intervention is the only path to improvement. This can lead to disappointment when such interventions do not provide complete relief. It can also discourage engagement in therapies that require effort, reflection, and time, but have strong evidence of effectiveness. Mental health recovery is rarely linear. People improve, relapse, and improve again. Progress is influenced by life events, stressors, and support systems. Brain scans cannot capture this process. They offer static images in a dynamic reality. Relying too heavily on them risks misunderstanding the nature of recovery itself. Responsible mental health care emphasizes collaboration, informed consent, and realistic expectations. Individuals should understand what tools can and cannot do. They should be empowered with knowledge, not overwhelmed by images that appear authoritative but lack clear meaning. Transparency about limitations is not a weakness, it is a foundation of ethical practice. Education plays a critical role in addressing the influence of viral brain scans. When people understand that science deals in probabilities rather than certainties, they are better equipped to evaluate claims. Teaching critical thinking and media literacy is as important as advancing technology. Without these skills, powerful tools can easily be misused or misunderstood. The future of mental health science may include more precise biological markers and personalized interventions. Research continues to explore genetics, brain connectivity, and biomarkers. These efforts are valuable and promising. However, progress should not be rushed or exaggerated. Premature claims risk harming public trust and diverting attention from proven methods of care. Ultimately, mental health cannot be separated from the human story. Experiences, relationships, losses, hopes, and values all shape psychological well-being. Brain scans capture only a fraction of this story, and often in ways that are difficult to interpret. Elevating images above lived experience reduces understanding rather than enhancing it. Confronting the popularity of viral brain scans is not about rejecting neuroscience. It is about placing neuroscience in its proper context. Technology should serve people, not define them. Images should inform, not intimidate. Science should empower, not oversimplify. A balanced approach to mental health recognizes the role of the brain while respecting the complexity of human experience. It values evidence, humility, and compassion. It resists the temptation of easy answers and remains committed to truth, even when that truth is uncertain or incomplete. As society continues to navigate the intersection of technology, media, and mental health, critical reflection becomes increasingly important. Visual tools can educate, but they can also mislead. The responsibility lies with professionals, creators, and audiences alike to demand accuracy, transparency, and ethical standards. In the end, genuine healing comes not from images alone, but from understanding connection and evidence-based care. Mental health deserves depth, patience, and respect. By looking beyond viral visuals and embracing complexity, we move closer to a more honest and humane understanding of the mind. The modern digital era, information spreads faster than ever before, and few forms of content travel as quickly as images that appear scientific and authoritative. Brain scans, especially those presented in bright colors and dramatic contrasts, have become powerful symbols of truth in the public imagination. When people see an image of the brain, they often assume they are looking directly at the source of thoughts, emotions, and behavior. This assumption creates a strong emotional reaction and encourages trust even before any explanation is given. As a result, viral brain scans have gained enormous influence in discussions about mental health, personality, intelligence, and human behavior. Many of these scans are presented as if they provide objective proof of mental health conditions. Viewers are told that certain colors represent problems, weaknesses, or damage, while other colors represent health or normal function. The message is often subtle, but clear. The image reveals hidden truths that words, interviews, or personal experiences cannot. For people who have struggled for years with anxiety, depression, attention problems, or emotional pain, this message can feel like a breakthrough. It promises clarity, certainty, and validation. It suggests that suffering is not imaginary or exaggerated, but visible and measurable. However, this promise of certainty is precisely where the problem begins. Mental health is one of the most complex areas of medicine because it sits at the intersection of biology, psychology, environment, and personal history. Unlike many physical illnesses, mental health conditions rarely have a single identifiable cause. They develop over time, shaped by genetics, upbringing, trauma, stress habits, relationships, and cultural expectations. Attempting to capture all of this complexity in a single image is not only unrealistic, but scientifically misleading. The brain scans commonly shown in viral content do not measure thoughts, emotions, beliefs, or character. They measure indirect signals, such as blood flow or metabolic activity, which can change from moment to moment. These signals are affected by countless variables: a poor night's sleep, emotional stress, caffeine intake, physical exercise, medication, hunger, dehydration, or even anticipation can alter brain activity. Because of this, two scans of the same person taken on different days can look noticeably different. even if nothing about their mental health has changed. This variability makes it extremely difficult to draw firm conclusions from a single scan. Yet viral presentations often ignore this uncertainty. Instead, they present images as fixed representations of a person's brain, implying permanence and precision. This creates a false sense of diagnosis, where viewers believe that a scan can definitively explain their struggles or predict their future. In reality, the science does not support such claims. Mental health diagnoses are based on patterns of experience and behavior over time. Clinicians look at how a person thinks, feels, acts, and relates to others. They consider the duration and severity of symptoms, the impact on daily functioning, and the individual's personal and social context. Brain scans, when used at all, are supplementary tools in research settings, not standalone diagnostic instruments. There is currently no scan that can reliably diagnose most psychiatric conditions on its own. One of the most concerning aspects of viral brain scans is the tendency to overinterpret what the images show. Complex data is simplified into labels that sound definitive. These labels suggest that mental health conditions have clear visual signatures that can be easily identified. In practice, this is not how the brain works. Similar patterns of activity can appear in people with very different experiences, and very different patterns can appear in people with the same diagnosis. This overinterpretation creates a misleading narrative in which mental health appears more certain and mechanical than it actually is. While this narrative may feel comforting, it can also be harmful. It encourages people to see their struggles as fixed brain defects rather than dynamic experiences that can change with time, support, and effort. It shifts attention away from personal growth, coping strategies, and environmental change and places it entirely on biology. Another serious issue is the psychological impact these images can have on individuals. When someone is shown a brain scan and told it represents damage or dysfunction, they are likely to internalize that message. The image becomes a powerful symbol that shapes how they see themselves. Normal emotional reactions may be reinterpreted as signs of permanent disorder. Temporary stress may be seen as evidence of lasting brain damage. This process is reinforced by confirmation bias. Once people believe that their brain is fundamentally flawed, they tend to notice information that supports that belief and ignore information that challenges it. Every bad day becomes proof. Every difficulty becomes confirmation. Over time, this mindset can reduce hope and motivation, making recovery feel impossible. This is particularly troubling because one of the strongest findings in modern neuroscience is that the brain is adaptable. Neural pathways change in response to experience, learning, therapy, and behavior. Psychological treatments, lifestyle changes, and social support can all lead to measurable changes in brain function. Presenting the brain as static and damaged contradicts this reality and undermines one of the most empowering truths about human mental health. The commercialization of brain scans adds another layer of concern. Many services offering these scans charge high fees and market them directly to consumers. The language used in promotion often emphasizes fear, urgency, or hidden danger. People are encouraged to believe that something is wrong with their brain even if they feel relatively normal, or that a scan is necessary to prevent future problems. In healthcare, ethical practice requires that benefits clearly outweigh risks and costs. When evidence for benefit is weak, aggressive marketing becomes problematic. Vulnerable individuals, especially those struggling with anxiety or uncertainty, may feel pressured into expensive procedures that offer little proven value. This is not a trivial issue. Financial stress and emotional distress can worsen mental health rather than improve it. The persistence of viral brain scan claims, despite criticism from experts, reflects broader challenges in how science is communicated to the public. Scientific progress is slow, cautious, and filled with uncertainty. Viral media, on the other hand, rewards confidence, simplicity, and emotional impact. Nuance does not spread as easily as certainty, even when certainty is unjustified. Many people also feel frustrated with traditional mental health care. Diagnosis can take time, treatment responses vary, and improvement is often gradual rather than dramatic. In this context, a brain scan that promises quick answers can feel like a solution to a broken system. It offers a sense of control and validation that is deeply appealing. However, appealing solutions are not always accurate solutions. When complex problems are reduced to simple explanations, Important factors are ignored. Mental health is shaped not only by the brain, but by relationships, work, purpose, culture, trauma, and meaning. These elements do not appear clearly on scans, yet they often play a decisive role in recovery. Psychotherapy, for example, has strong evidence supporting its effectiveness for many conditions. Changes in thought patterns, emotional regulation, and interpersonal behavior can lead to lasting improvement. Exercise, sleep, nutrition, and social connection also have well-documented effects on mental well-being. None of these interventions require a brain scan to be effective. Responsible use of brain science requires humility. Imaging technologies are valuable research tools that help scientists study patterns across large groups. They contribute to our understanding of how the brain functions on average, not how a single individual's mind works in daily life. Applying these tools outside their validated purpose risks misinforming rather than educating. True scientific integrity involves acknowledging limitations, uncertainties, and gaps in knowledge. It involves resisting the temptation to make dramatic claims when evidence is incomplete. It prioritizes patient welfare over visual impact and marketing appeal. Ultimately, confronting viral brain scans is about protecting people from false certainty. It is about reminding society that mental health cannot be reduced to an image, no matter how colorful or convincing. Healing comes from understanding, support, patience, and evidence-based care, not from visual shortcuts. As neuroscience continues to advance, new tools may one day play a greater role in mental health diagnosis and treatment. Until then, skepticism is not opposition to science. It is a necessary part of responsible science. By choosing evidence over appearance and nuance over certainty, we move closer to a more honest and humane approach to mental health. In the age of social media, visual content has become one of the most powerful tools for shaping public opinion. Images that look scientific, complex, and high-tech often carry an automatic sense of authority. Among the most striking examples of this phenomenon are colorful brain scans that circulate widely online, claiming to reveal hidden truths about mental health, personality, intelligence, and behavior. These images are often presented as revolutionary breakthroughs, tools that can finally explain why people think, feel, and act the way they do. At first glance, these brain scans appear to offer something deeply appealing: clarity. Mental health is complicated, emotional, and often frustratingly subjective. Many people struggle for years without clear answers, moving from one diagnosis to another. The idea that a single scan could objectively reveal what is wrong with the brain feels comforting and empowering. It promises certainty in a field full of ambiguity. However, when these viral brain scans are examined more closely through the lens of modern neuroscience and evidence-based medicine, serious concerns begin to emerge. The confrontation with these claims is not about rejecting brain science. Instead, it is about defending scientific integrity, protecting patients from misleading information, and ensuring that medical tools are used responsibly rather than sensationally. This discussion explores what these viral brain scans actually measure, how they are often misinterpreted, why most medical experts remain skeptical, and how oversimplified neuroscience can ultimately harm the very people it claims to help. The appeal of brain images to the human mind. Human beings are visual learners. We instinctively trust what we can see, especially when it looks technical or complex. Brain scans tap directly into this psychological tendency. A colorful image of the brain filled with reds, blues, and yellows feels more convincing than a long explanation or a clinical interview. Research in psychology has shown that people are more likely to believe explanations when they are accompanied by brain images, even if the images add no real scientific value. This phenomenon is sometimes referred to as neurorealism, where neuroscience visuals give claims an undeserved sense of objectivity and truth. When someone is shown a brain scan and told that certain colors represent problems like anxiety, depression, or attention issues, the explanation feels concrete. The problem appears to be located in a specific place. This creates a powerful narrative. This is not your fault. Your brain looks this way. While this message can reduce shame, it can also oversimplify reality. Mental health is not just a matter of colorful patterns on a scan. It is shaped by a complex interaction of biology, psychology, environment, trauma, habits, relationships, and culture. Reducing this complexity to a single image risks misunderstanding both the problem and its solution. What these brain scans actually measure: The brain scans commonly used in viral content are designed to measure blood flow or activity patterns, not thoughts, emotions, or diagnoses. Blood flow in the brain changes constantly. It is influenced by countless factors, including sleep quality, stress levels, recent physical activity, caffeine or nicotine intake, medications, emotional state, hunger or dehydration, time of day. Because of this, brain activity is not fixed. The same person can have different scan results on different days. This makes it extremely difficult to draw strong conclusions about mental health conditions based on a single scan. Importantly, these scans do not directly diagnose psychiatric disorders. Conditions such as depression, anxiety, ADHD, PTSD, and personality disorders are defined by patterns of behavior, thoughts, emotions, and life experiences, not by a single biological marker. There is currently no brain scan that can reliably diagnose most mental health conditions on its own. The problem of overinterpretation. One of the most significant issues with viral brain scans is overinterpretation. Complex data is often simplified into clear labels, such as "this is a depressed brain" or "this is an anxious brain." These labels suggest certainty where none exists. In reality, the same scan pattern can appear in many different situations. A person who did not sleep well, someone under acute stress, and someone with a diagnosed mental health condition may all show similar brain activity patterns. Conversely, two people with the same diagnosis may have very different scans. Science requires caution, probability, and uncertainty. Viral content, however, thrives on confidence and simplicity. When nuance is removed, viewers are left with a misleading impression that brain scans can provide clear answers to deeply complex problems. Diagnostic accuracy and scientific standards. For any medical tool to be considered reliable, it must meet strict scientific standards. A good diagnostic test must be reliable. It produces consistent results over time. Specific, it can distinguish between different conditions. Sensitive, it correctly identifies those who have the condition. Clinically useful, it improves treatment outcomes. Viral brain scans fail to meet these standards when used as diagnostic tools for mental health conditions. Large-scale, controlled studies have not shown that these scans can reliably distinguish between different psychiatric disorders or improve patient outcomes beyond standard methods. This is why most hospitals, universities, and psychiatric associations do not use these scans in routine mental health diagnosis. Instead, clinicians rely on detailed patient histories, structured interviews, behavioral observation, and validated psychological assessments. These methods may seem less exciting than colorful images, but they are grounded in decades of research. Confirmation bias and psychological impact. Another serious concern is the psychological effect these scans can have on patients. When people are shown an image of their brain and told it represents damage or dysfunction, they are likely to believe it, even if the interpretation is uncertain or incorrect. This is known as confirmation bias. Once a person believes their brain is fundamentally flawed, they may reinterpret their entire life through that lens. Normal struggles become symptoms. Temporary stress becomes a permanent condition. This can reduce hope rather than increase it. There is also a risk of self-limiting beliefs. If someone believes their brain is broken, they may feel less capable of change. This contradicts one of the most important findings in neuroscience neuroplasticity. The brain is adaptable. Thoughts, behaviors, therapy, learning, exercise, and environment all shape brain function over time. Ironically, the way viral brain scans are presented can undermine this empowering truth. The commercialization of certainty. Many viral brain scan services are expensive and not covered by insurance. They are often marketed directly to consumers using emotionally charged language that emphasizes hidden damage, undiagnosed problems, or missed opportunities for early intervention. This raises ethical concerns. When fear and hope are used to sell medical services, the risk of exploitation increases, especially for people who are vulnerable, anxious, or desperate for answers. In medicine, financial incentives must always be balanced by strong evidence. When extraordinary claims are made, they require extraordinary proof. Without that proof, marketing brain scans as diagnostic tools crosses a line from education into persuasion. Why these claims persist despite criticism? If the scientific community remains skeptical, why do these brain scans continue to gain popularity? One reason is that mental health care often feels slow and imperfect. Therapy takes time. Medications do not work for everyone. Diagnosis can change. In contrast, a brain scan offers instant feedback and a sense of control. Another reason is storytelling. Viral content is not built on careful scientific debate. It is built on compelling narratives. A scan that reveals the truth fits perfectly into this model. Finally, there is a general lack of public understanding about how science works. Many people assume that if something looks advanced and technological, it must be accurate. They are rarely exposed to discussions about false positives, statistical noise, or methodological limitations, the danger of oversimplifying mental health. Mental health is deeply personal. It is shaped by childhood experiences, relationships, culture, trauma, stress, purpose, and meaning. While biology plays an important role, it is only one piece of a much larger puzzle. Oversimplifying mental health into brain images risks ignoring social and psychological interventions that are proven to help. Therapy, social support, sleep, exercise, nutrition, and purpose-driven behavior all have strong evidence behind them. None of these show up clearly on a scan, yet they can dramatically change lives. Responsible use of brain science. None of this means that brain imaging is useless. In research settings, brain scans are invaluable tools for understanding how the brain works on a group level. They help scientists explore patterns, correlations, and mechanisms. However, research tools are not the same as diagnostic tools. Responsible science communicates uncertainty honestly. It avoids definitive claims when the evidence is limited. It prioritizes patient well-being over visual impact. Conclusion: choosing evidence over images. Confronting viral brain scans is ultimately about choosing evidence over appearance, nuance over certainty, and care over marketing. Mental health deserves respect, patience, and honesty. While the brain is central to who we are, it cannot be reduced to a single image or color-coded map. True understanding comes from listening to people's stories, examining their experiences, and using tools that have been proven to help, not from relying on images that look convincing but lack solid scientific support. As neuroscience continues to advance, new tools may one day transform mental health diagnosis. Until then, skepticism is not negativity, it is responsibility. The goal should not be viral success, but real healing grounded in truth,